It's common BJJ finger injuries. We're going to do a 30-minute to 40-minute talk today, just about a couple. We're going to cover one main BJJ finger injury that we commonly see, and kind of initial steps, how to look at it, and what to do initially in order to maintain it, manage it. So we're going to get started here in a couple minutes. What we're going to focus on is collateral ligament injuries of the fingers. And so commonly the most affected joint is this PIP, so proximal interphalangeal joint. And on either side of the joint tends to bend up and down like this. It's what we normally see. On either side of the joint, there's a piece of tissue, a ligament that's really strong, kind of bandy tissue that comes across the joint in order to protect it, in order to stop it from moving side to side. We have on each of the joints, we have a ligament on the inside and a ligament on the outside. And so these collateral ligament injuries, I see a lot of people with what they call BJJ fingers, but these parts of the knuckles tend to get really enlarged, and we have a kind of a growth or bony growth around them, and you can just tell that they've been damaged before over time. So what we're going to go over today is the anatomy of the ligament, which we're going to cover really quick, and then we're going to go over kind of the mechanisms of injury that we see, so what commonly causes the injury, so we can understand if it happens. This is a potential injury that you do have. And then we're also going to go over a quick assessment of those ligaments and the finger itself to figure out how bad the damage is if you did get injured there, what got damaged, is it the ligament or the joint, and then some initial steps depending on what we find in order to help self-manage it, improve it, rehab it if we need going forward in order to keep you training and keep you doing jiu-jitsu. So to start with, as we talked about, those ligaments that come across the joint itself, and so through here the joint bends in the middle and the ligament comes below it and it comes over top above it. And so on either side, that ligament will support the joint. And so we have normal bending and extending up and down, but if that joint gets stressed side to side, so if I have a force coming this way and it stresses that joint, that collateral ligament will stop that movement and it keeps the joint in line. And so commonly in jiu-jitsu, where we see these injuries happen is either with a straight finger that gets jammed, so we get kind of force this way and it buckles and bends, and we'll get this big shift and a lot of pressure on the ligament itself. We can get damage that way. The other way we see it is with grips, so when we're holding gis, or when people are trying to break them, the finger itself, it can get kind of pulled and twisted, and that twisting force on the finger will also stress that outside structure, and it can lead to damage to the ligament on top of it. So these are the two most common ways. There's also a third way we see sometimes, and it's kind of this jammed finger movement, where as we kind of post on the ground, post on somebody, that finger will get caught, and when it does get caught, it stresses that ligament, and then we get irritation, damage potentially, and pain. So those are the common mechanisms of injury that we do see in order for the collateral ligaments to get injured. And so once we do have an injury, common symptoms in those fingers that we see if you do damage that collateral ligament, pain, so the joint itself, a lot of people describe it as a jam finger, so you'll get pain in and around the joint. It's pretty sensitive to touch, especially on the inside or outside of the joint. It can be generally irritated or sensitive, but on the outsides of the joints are generally painful to press and move around and push on. The other thing is the joint itself will get pretty swollen, so it does get kind of fat. There's a lot of fluid around it, and because of that, the range of movement of the joint is severely limited. So with that kind of jammed finger symptoms, it's really difficult to bend the fingers all the way, and sometimes even to extend the fingers all the way. You'll lose range of movement, and it'll be painful in order to kind of push it in there. And then the other thing we get is potential instability of the joint. So some people start to feel like the joint starts to slip. It doesn't have strength in the finger. It feels like it's going to re-injure. It's kind of loose and moving around. So those kind of symptoms come in and after when we damage one of these collateral ligaments. And so when we start to look at collateral ligaments, if somebody has a finger injury, the testing that we do tends to be around figuring out if the ligament's damaged, if it is damaged, how bad it's damaged, and then if it's not, what are the other factors, and usually it's the joint itself. And so when we're looking at diagnosing an LCL or MCL ligament, the lateral collateral ligament, so on the finger, the outside of it, or the medial collateral ligament, the MCL, on the inside of it, the the first thing we can do is just figure out what happened to the finger. So if you fall into the category of one of those common mechanisms, so something kind of jammed the finger straight, it was kind of twisted and pulled, or maybe we posted on it and we get this big kind of lateral bend on the finger. Those are the common mechanisms. So if something like that happened, we need to start looking at the collateral ligament in order to figure out if that's the case. We can start to feel around the finger itself too. So generally the sensitivity is on the inside and outside of the joint, like we mentioned. So if you start to poke in and around the sides of the joints or squeeze them, you'll have a lot of sensitivity on the joint line itself. The ligaments are small, they're hard to feel, you can't really feel them that well, but what you can do is if you squeeze both sides of the finger and kind of rub your fingers up and down, you'll feel two bones and there'll be kind of a valley in between them, and that's the joint line where the finger knuckle bends, and that joint line is where that ligament goes across. So if you squeeze your finger like this, and then you kind of move it side to side, you'll feel that joint line, and in and around there, if we have sensitivity in there, any swelling, things like that, there's likely kind of some sort of damage to that ligament. And so that next step is if we do have damage, we do have pain, sensitivity, swelling, all those things, and we're thinking that ligament got damaged, next is kind of testing to figure out how much it got damaged. And so in general, the ligament damage itself, we grade it from a 0 to a 3. 0 being kind of a mild irritation or a light stretch, light sprain, maybe it's inflamed a little bit. The actual structure of the ligament, which is a bunch of collagen fibers that all run parallel to each other and they're really strong, pulling in one direction. As a grade 0 is the actual fibers. How we grade it is the percentage of the fibers that have gotten damaged. So a 0 is none of the fibers got damaged, so it's irritable, it maybe got overstretched, it's got some inflammation around it, it's painful, but structurally it's still very, very sound. A grade 1 is kind of up to 25% of those fibers are damaged, and it's hard to be very, very accurate with this. It's just a general assumption based on the severity of the symptoms and then the stability of the joint, which we're going to get to next. And really you can only accurately diagnose this with an ultrasound, and that's even still really difficult because it's such a small amount of tissue that's in there. But grade 1 is kind of an assumption of like up to 25% of the fibers got damaged, so the whole ligament structurally is sound, but 25% of the fibers are probably torn, ruptured, damaged, not at their capacity to kind of provide stability for the joint. A grade 2 is up to 50%, so if we look at the whole structure itself, half of it is going to be damaged, and then grade 3 is full rupture. So we're getting complete tear of that ligament. There's no stability in that joint anymore. There's nothing that's stopping that side-to-side movement, which brings us to that stability testing of the joint, and we can tell if that ligament is compromised in a way where it's not able to stabilize the joint, and we're going to get some slipping and gapping, or if there's some structures left. So generally, grade 3s are the worst kind, of course, because we're going to lose stability of that joint. It's going to be much harder to rehab without re-irritating it. The worst case scenario is sometimes with these, with the full rupture, you can also get bony injury too, because the ligament attaches to the bone. It's not common with these collateral ligament injuries, but sometimes the ligament can pull off the bone. It's called an avulsion fracture, and the ligament itself stays intact, but one end of the ligament pulls off the bone, and you have instability that way too. Regardless, you're going to treat it and approach it the same way, but it can cause kind of different symptoms as you rehab the collateral ligament injury. So once we figure out there's damage to the ligament, we're going to test the stability of the joint, and it's very, very simple to do. So pretty much you take the joint itself, and we're going to create a base below the knuckle, and we're going to push on top of the knuckle. So in doing so, if I block it here and push on this side, we're going to stress this side of the finger, because what happens is it wants to gap over here, and we're pushing the bones apart. And so in doing this valgus varus testing, what we're looking at is we're trying to see, does the joint itself have any spring to it? So if I push here, does the joint kind of stretch but remain stable? It's probably going to be painful, but what we're looking for is if it's fully ruptured or not. And so how you'll tell is the instability of the joint. And a lot of times when you have a full rupture, if you do these testing, so you do one side and then you do the other, when you put pressure on that joint, you'll feel the two finger joints where they connect, you'll feel it actually slip out of place. And this is very, very apparent when it does happen, and you can feel it. You can almost feel the bones slide out of place. It's very painful, and you can kind of reproduce it really, really quickly and easily with these tests. And that's how you know you probably have a full rupture and that ligament isn't giving the joint any stability anymore, which leads down kind of what you need to do about it. And so grading the level of the ligament injury is really important because it informs what you need to do in order to let it heal properly. So with these, there's not a whole lot you can do. If you put the joint in a stable position, any damage to the ligament, it'll heal itself, so it'll start to reattach and it'll reform. If you don't, and if you keep training on it, keep using it, kind of pushing through the pain with that ligament damage, what will end up happening is the joint itself will build up either calcium deposits to help build stability through the joint, and or kind of bony growth in order to build stability through the joint. So you end up with these big, kind of wide knuckles. This is the kind of classic jiu-jitsu fingers that you see a lot of the seasoned veteran black belts have, and their fingers look all gnarly. And so they're getting ligament damage in there, and then it's not healing properly, so you get this kind of calcium growth and deposit in there. And so if we have, so grades kind of 0 to 2, in general, to manage them, we can just do it with buddy taping. So there's still going to be swelling, there's still going to be pain, and a little bit of lack of strength and lack of range of movement through the joint. So initially, through those first 2 weeks, the healing phase that we're going to go through, we want to try to stabilize the joint as much as possible and reduce forces through that ligament. So, for example, say we have a ligament damage on the outside of the finger. There's going to be damage anytime that finger gets pushed inwards. It's going to put pressure over where that ligament should stabilize, and it's going to delay that healing, or kind of poke the bruise is what we end up calling it, where you have a little bit of damage and you're just kind of re-irritating it and delaying that healing time frame. So you can brace the finger. They have soft braces. They're just kind of Velcro straps that go on the finger, and they'll stabilize it itself with a kind of a hard plate on the side of it to prevent that movement. What a lot of people end up doing is buddy taping. So most people have heard of that and seen it, and there's a couple tips that make it easier to buddy tape it correctly, which we're going to go over in a minute. And then if we do have, so those are all for kind of partial or potentially full ruptures too, where we just want to stabilize the joint. And in general, the first 2 weeks is going to be the first kind of healing time frame where things will start to calm down, the pain will reduce, the swelling will reduce. You might have a little bit of joint limitation still, but that first 2 weeks is the initial time frame, and then 6 weeks is kind of the marker where, in general, the research shows that 6 week marks is how long you want to stabilize the joint, how long you want to protect it and brace it for, trying to avoid re-injury. Anytime you re-irritate it or re-injure it, that 6 week time frame tends to restart. And so if you continue to re-injure it, re-hurt it, that's where you see the calcium deposits and the bony growth start to build up. And so it's about treating the joint correctly and still training so that you can heal and not get these kind of big bony deposits. That stability through the joint keeps your hands healthier. So buddy taping, very, very simple. Most people have done it. I'll show an example. So you just use kind of regular zinc oxide tape. A couple of tips that help, because the big thing with these is once you start actually training the sweat, it slips off, and so it doesn't really end up being that effective. So if you can actually get a hard brace, that tends to work better. They have them, they're pretty cheap. The brace goes over the joint. It has like a bar or a hard plastic structure, and then it velcros, and you can put it on pretty tight, and it stays on a little bit more stable. But if you're using tape, use zinc oxide tape, just the white athletic tape. Tear off a piece and then split it in two. And then what we're going to do is, the most common finger that gets hurt with these is the ring finger. It's the weakest one in terms of the stability because it relies on the other muscles in the tendons as it splits. It doesn't have good kind of independent strength and stability. So if it's the ring finger that's injured, which is most common, we're going to buddy tape it to that fifth finger, so over to the pinky finger, and it gives you more stability this way. The other reason we do that is if we buddy tape it to the middle finger, so say we have a ring finger that's injured, we buddy tape it to the middle finger, this pinky finger stays by itself and it tends to get caught, and then we get further finger injuries because we're not protecting that fifth finger because it's just kind of hanging out by itself. So ring fingers we tape to the pinky finger. Say we have the middle finger injured, we're going to tape it to either the index finger or the ring finger. But in general, if you tape it here, we still get this fifth finger outline, so you're taping all three. So generally we tape it here, and then if you get this index finger injured, we're going to tape it to that middle finger as well. So how we do this, kind of top tip, it does slip off, so the tape slips off when you get sweaty. Also, the oils on your hands help the tape to not stick. So what we want to do, if we can clear the oils, so if you have like an alcohol prep pad, or wash your hands really well, it'll take the oils off and the tape will stick a lot better. When we tape it, so we want to do two things. So this joint's the most common one affected. If we're stabilizing this joint, we want to tape above and below it. If you get any tape on the joint itself, it's going to be really hard to bend. So to keep full movement of the finger, we want to tape above and below each joint, but because the joints are different heights, the top line is going to end up coming at an angle versus straight. So we're going to tape below this joint, but we're going to come as far as we can into the creases of the finger. So in through here, and making sure that we don't tape on top of the joint but below it. So holding the fingers together, and you're going to get it as tight as you can. And then come down. So very, very basic. You only need 1, maybe 2 wraps, but we should be able to bend the fingers fully still when we do this. If we can't, the tape's too high on the joint and it's blocking the movement, but we want full grip still. So below the joint, that's how we do it. And the top of the joint, you can see the difference in height, so we're going to kind of come at an angle. So we get the other one, another piece of tape. Same thing, we go in between the joints, so above the joint we're trying to stabilize. And we're going to come down, and so that we're below the pinky joint as well. So we should keep both of these joints clear on top of it as well. So we come across here. So this one would kind of be at a diagonal angle. And again, you can do kind of 2 wraps on it, making sure we're not on top of the joint. And so from here, we should still be able to make a full grip if it's clean. If you have too much tape on top of the joint, what will end up happening is you'll be limited, and these fingers will come down, but these will be stuck. So in through this will be a good tape. You can also test it. So if I push, we shouldn't get a whole lot of loading on the inside. The finger should move as one. It's nice and tight. And that's how we buddy tape for collateral ligament injuries. Anytime you're training, anytime you're using your hands, lifting weights, things like that, it's a good idea to do this. If you have a really severe one, very sensitive or full rupture, it's also recommended to wear a splint at nighttime so you don't catch it and then re-injure it and start your 6-week healing process over. So that's the way that we buddy tape the fingers when you get those lateral collateral ligament injuries. The other thing that we can do, so if the other option is when we're assessing the finger itself, if we don't have full ligament instability, so the ligament's not ruptured, it's just irritated, we go through that healing time frame, and as it starts to feel better, we want to normalize the ability to get the joint to go through its full range. So if we have limitations in the joint, typically what ends up happening is with those jammed fingers is we can't bend it all the way. So a normal finger will bend completely down, and we'll get something like this where the swelling will stop it and we can't get it all the way without pain. So a nice way to start to treat the joint, so if the ligament itself isn't fully ruptured and we're not waiting for that to heal, we can actually start to treat the joint and to calm the pain down. And so these, typically what we use is a technique called mobilization with movement. It's pretty effective. A patient that comes to mind, we helped a guy, and he had his hand planted, and then he got pulled and twisted, and his finger got ripped to the side. So he kind of had this hand plant, and he got this big finger side bend, and he had a lot of finger pain in through here. He waited for about 6 to 8 weeks. It was feeling better, but it was still painful. He got to a point where he couldn't hold grocery bags without kind of severe pain. It would flare up and swell. Then he was kind of on his way to go get MRIs to look at it in order to see what was going on in there. But the stability testing was fine, so it wasn't unstable. The ligament was fine, but he was still getting these severe flare-ups and pain. So when we looked at it, he still had lack of range of movement, and he was unable to kind of fully extend, fully bend it without any kind of pain. So what we did is you go to these mobilization with movement techniques, and all we're doing is the joint itself, when we get damage to the joint like this, typically there's kind of an offset. So the joint congruency, it likes to be in its space, and it bends and straightens really nicely. And what ends up happening sometimes with these injuries is we get a little bit of an offset of the joint. And so as we bend and straighten, it doesn't go through its full range like it should, and it's being blocked by the other joint. Also cause irritation of the joint. Having any loading is painful. So this mobilization with movement concept, what we want to do is we want to figure out which side the joint is shifted to, up or down. And what we want to do is try and gap the joint, correct it, and then start to move it through its normal range. And what that'll do is help pain levels come down, and it'll reorient the injury and help it calm down. So with this guy, he was having issues holding groceries. His finger was super painful. We just started doing some mobilization with movement treatment on it, and his pain levels went from a 7 or an 8 with kind of basic activities down to 0 in 2 weeks, and his finger's 100% healed. So it's another factor. It's not always the ligament. Sometimes it's the joint that's irritated on top of it. So how we do those mobilization with movement techniques, If we're limited in this bending movement, what we can do is if we grab on top of the joint and we're going to pull it apart. So as we pull it, we'll get a little bit of a gap, kind of a sulcus we'll see at the top knuckle, but also in this knuckle we'll get a little bit of it too. So what we're going to do is we're going to pull the finger, and as we add pressure on the finger, we're going to bend it down through its full range. And you're going to get to a point where it's a little bit painful, but you should get a bit further than you can without it. And we're going to hold it, and then we'll come back up, and we're just through 30 repetitions, we're just going to add that pressure, pulling on the finger, and taking it through its full range. And we do this multiple times a day, 3 to 4 times a day, whenever you can remember to do it. And what ends up happening is the joint itself, we get pressure off of it, and that range of movement starts to improve, and we'll get back to full range in probably a week to kind of 2 weeks is typical. So in terms of gaining the range of movement into flexion, that's the best way to do it. The other thing that happens is this joint, this kind of offset that we're talking about, we can figure out which way it's offset, and usually you can tell by the injury, but the other way is just to test both sides. So what we want to do is that initial testing where we added pressure to one side or the other, we're going to do the same thing, but we're going to try and reposition the joint as straight as we can and then bend it through its range. And what we're looking for is if we go in the correct direction, if we adjust the joint in the right way, as we go through the range, the pain level should be drastically different. So for example, this patient that we worked with his finger injury, he was having pain and he put it at kind of a 5 or a 6 just trying to bend it. We push the finger one way, so we brace the top and then squeeze them together. So if you can think about this top of the knuckles going down, this bottom part's coming up. So we adjusted the joint in this direction, and then we went and tried to bend the finger, and it made the pain worse. So it made it from a 5 or 6, it went up to a 7 or an 8. So we know we're pushing the joint in the direction that it's already irritable. It's out of alignment that way. So we do the other direction. So we push the bottom joint the other way, push the top joint the other way. So instead of coming down like this, we do the opposite, where we come like this. So we brace this and push this one down. So we adjusted the joint in that way, and then we have him bend it through his range, and the pain levels go from a 5 or 6 normally down to a 1 or a 2. And so that mobilization with movement technique shows that we're putting the joint in a better position as the pain levels go down. So then, same thing as the distraction and bending, we're going to adjust the joint, bend it through its range with reduced pain. We do 30 repetitions, take a break, and we do that 3 or 4 times throughout the day. Within a week or two, your finger pain will go down and you'll return to kind of normal range of movement. And that's when you start developing strength in the hand. You can work on great grip exercises, specific kind of finger work, things like that. But in order to get the pain level down, those are the best kind of techniques with BJJ finger injuries, is those mobilization with movement techniques. And so we did this with that patient. 2 weeks he's fine. His finger is completely fine now, no problems. And it's just a basic common strategy that you should try to be using when you are dealing with kind of finger injuries going on. So that's the kind of general overview. Lateral collateral ligament injuries. There's other common injuries as well. So we have mallet finger, jersey finger, boutonniere finger, other injuries that typically happen, which we're going to cover later on in next week's kind of live videos going forward. And we're going to have posts about them. We have a blog post about it on our website too. You can go kind of read more information about it. But those are the most common injuries that we see, and those different mechanisms of injuries and different tissues that get damaged lead to different symptoms. But for today, we covered that lateral collateral ligaments on the fingers. This joint's the most common one affected for those types of injuries. If we have those, we look at the stability and the symptoms of the joint to grade the collateral ligament injury. Is it a grade 0, no damage, or is it a grade 3, full rupture, or somewhere in between? Depending on what we find, we'll brace it in order to treat it. You have a 2-week initial time period to initial healing time frame that goes on, and then we need to stabilize that joint and not re-irritate it for 6 weeks in order for it to heal properly, or else we'll get calcium buildup and we'll get bone buildup, and the joint itself gets fat, and we get those classic BJJ fingers that we see. Once we stabilize it, once we confirm there's no collateral ligament injury, we can also look at the joint in terms of lingering symptoms, lingering pain. If that's the case, then we can go through those mobilization with movement techniques in order to bring the pain levels down. So the general overview, that's the basics of collateral ligament injuries. The 101, kind of the overview, what you should understand. If you're struggling with an injury like this, reach out to us, let us know. They can be more complex and then sometimes even more simple than that. So let us know. There's some basics that you can do in order to get your fingers improved. And we don't want to see these kind of big knuckle flare-ups and these big kind of calcium deposits form. And so keep your fingers healthy, keep your fingers strong, do the right things from the get-go, and it'll pay dividends versus kind of building up over time and losing range and strength and having kind of lingering pain in your fingers. So that's it. I know there's a couple people still in here. Thanks for joining. If you have any questions, anybody let me know. If you had injuries like this, write them in the comments. If you have any questions about kind of lingering injuries, let me know. But that's kind of the general overview of the collateral ligaments. If anybody has had one, how bad is it? Doran, if calcium forms, what happens? So the calcium starts to form, it puts down deposit, and it transfers into bone. So the point is it's laying down calcium, and then over time that calcium will turn to a bony growth. And what it's trying to do is literally grow bone over the joint, because you're not in a position where the ligament can re-heal or reattach, so it starts to lay down more permanent stability for the joint. So kind of a common thing you'll see, this is a different injury, but you'll see these kind of mallet fingers, where this tendon that extends the finger, it comes up, those get injured. But it's the same thing. If you don't brace it and heal it correctly, you'll get like this, you see these big bumps, and that's a calcium and bony growth for stability in the joint. So that's I didn't rehab that because I didn't understand what I was doing, and so that was when I was in college, I didn't know how to heal a joint, and so you end up with stuff like this, but you get them all over the fingers. So it's a good question. So forever crooked fingers, exactly, forever crooked fingers. Your hand model days are over. So anyway, we'd reverse that surgery. You can't reverse the bone. Once it's there, it's there. So you're going in there and shaving it off. So if you're a hand model, then it's probably recommended. Other than that, it's part of it. You should have started from the beginning and kind of rehabbed it. In general, bracing's the best way to start. If you're unsure, just brace the finger, let it stabilize, and let it heal. Good questions, though. If other people have finger injuries or have had finger injuries, let me know. Any kind of collateral ligament injuries, any instability, any kind of bad cases, BJJ fingers, anything like that, let me know in the comments. No more hand picks. No more. But all right, so that'll kind of wrap us up. So if there's any other questions, let us know. But kind of a general overview for kind of collateral ligament injuries of the finger. Next week we're going to talk about the other ones, jersey finger, boutonniere finger, mallet finger as well, just different structures and what to do about them. You brace them in different ways and you treat them in a little bit of a different way. But in general, that finger taping is a good place to start if you don't have a brace. And if you do have a brace, use that, or you can go online and get them pretty cheap as well. So perfect. Thanks everybody for joining. Hopefully it helped, and we'll see you next week. How do I end this thing?